Hi, I'm Dr. Gulani. What a pleasure to be here today with all of you. I first want to thank all my patients, so many of you who've traveled here for so many years and given me the opportunity to work with you, the keratoconus patients in particular, who I'll be talking about today. And a lot of you had suggested for me to share what I've been doing for over 25 years and my own ecstasy, if you may, of seeing so many of you see even 20/20 despite your keratoconus. So a lot of you said, and I have seen it here, that you all have options only of a corneal transplant or a hard contact lens in most cases. But there's lots in between. Keratoconus patients today, with technologies that we have, the innovative techniques, combination technologies, actually keratoconus patients can see and even see without glasses or contacts and without a transplant. So for the eye surgeons here who asked to be on this and want to hear me today, first of all, I appreciate your skills. I'm sure you guys are amazing. And transplant is one of the choices for keratoconus, but may I encourage you to keep it as the last resort. Corneal transplant replaces the patient's cornea but doesn't directly correlate to unaided emmetropia. I want you to think about modalities by which we can optically manipulate the keratoconic eyes despite their bent cornea and make them see 20/20, if not 20/20, at least freedom to see with what I call vision imprisonment that they are stuck with. Optometrists who are here watching this and hearing me on their request, you'll do a great job with your hard contact lenses, scleral contact lenses, the 3D printed lenses nowadays, but again, please be a little more careful about just giving it to every keratoconic patient, because first allow the keratoconus patient to get the full opportunity to see with various technologies and surgeries today, and then you can always be part of the system of helping them reach another level of vision after surgery if for some reason they don't have 20/20 capacity. So I think this is also a great zone. Keratoconus patients have a great zone where eye surgeons, optometrists, and the entire eye care doctors as a community are fighting to make them see. And my own perception about these things is a hard contact lens or a specialty contact lens makes you see, but that's like what I call a Superman suit. You're a perfect six-pack even though behind it you're a keratoconic cornea which is not corrected. So various concepts today, lasers, cross linkings, Intacs, ICLs, pseudo-phakic lenses like Toric Lens Implants, phakic implants like ICL, and then combinations of all these can be done to make patients with keratoconus patients actually see optically despite what I call a bent cornea. And then if you have scars, if you have associated cataracts, once again those are opportunities to make you see. So just having a keratoconus diagnosis should not limit any eye surgeon, any eye doctor to the level that they should aim for in these patients. I have been surprised over 2 decades ago, and hence I'm surprised every day when I see my patients landing at excellent vision, so many of them. And again, I want to take this opportunity to thank my patients who I'm indebted to forever for what they allow me to do. One more important thing today, my team will be preparing our website literally into like an encyclopedia of information. Not only will it have information on thoughts that I believe in, results that are produced, and surgeries that are there for eye surgeons to look at, but also interviews in ophthalmology times, the patient interactions. Just read, review, share, change your concept. So I would encourage eye surgeons to move on from being surgeons to raising the bar on themselves, aiming for vision in keratoconus patients. I would encourage optometrists to keep supporting by improving vision further beyond surgery with contact lens concepts. And I would first want the patients of keratoconus not to despair. I want you to sit down with your eye doctor, make a plan designed for you. This concept I call think outside the cone. The whole concept of from between transplant and hard contact lenses, all these surgical modalities and innovations that can help you see like you never have before.